Good afternoon, everyone. Thank you for joining us for this webinar on cardiac health and education. My name is Paul O. I'm the medical director at the University Health Network Cardiovascular Disease Prevention and Rehabilitation Program. We are delighted that many of our colleagues are able to join us today. Today's session is an opportunity for us to continue to connect virtually to replace those wonderful encounters that we're putting on hold for now in our face-to-face world during this time of COVID-19. Here are some thoughts before we get into the heart of the matter today, that we're hearing quite rightly throughout the media that this practice of social distancing is so important. And it's interesting, we've never actually used this terminology before, but in the last week, 10 days, this has become the norm, and we've heard this hundreds, if not thousands of times in the last number of days. And we want to say we're absolutely supportive of these sorts of concepts, that it's important for us to stay physically apart from each other, maintain a 2-meter distance. Certainly in our program, in our day-to-day encounters, we're doing our very best to maintain this sort of distance. We don't want to congregate in large groups, and hence these opportunities are very interesting for us. We may be spending more time using telephone and television and computers to connect. We absolutely want to protect those who are living with chronic conditions, who may be frail, and we want them to enjoy a virus-free existence as much as possible. And then the fifth circle that is shown here is how we can connect in a virtual way. And we, again, do feel that this is incredibly important. But we thought we would take this term social distance and actually turn it on its head to some degree and say, instead of social distance, that we want to take this apart and actually talk about social connections coupled with physical distance. And I think this session today is a great example of how we're going to put this into play. And indeed, in the news and from our healthcare leaders in the last couple of days, we've been hearing more the emphasis on physical distancing as opposed to social distancing. So we are grateful to all of you for joining in today for this session where we can actually be connected in a virtual world. Now, we are linking together using one of these digital meeting platforms, and in this case, it is Zoom. And I'm sure many of you are chatting with friends, family, engaging with different kinds of media using these types of platforms. This is one that we've embarked on for the purpose of delivering this kind of webinar. Just a point of orientation to your platform, if you hover over the lower part of your screen, you'll see this little area here that's called Q&A. And that's the place where we would ask you to enter in your questions. What will come up is this box on the right-hand side where you will be able to type in your questions and answers as we go through the session. I will be checking on this periodically, and my colleagues will be checking in on this periodically through the course of the session. Now, to let you know, there's 51 participants online right now, which is terrific. I'm looking at the Q&A box. We don't have anything in there at the moment, but as you start to think of questions, if you'll put them in there, we'll pause at deliberate points through the course of this conversation and have a look. And we'll also deliberately have an open question and answer at the end of this session. We also thought it'd be important to set a few ground rules for this. These sessions that we'll be delivering today and every Monday, Tuesday, Wednesday, Thursday for the foreseeable future are for education only. Many of you who are seeing healthcare practitioners for your own care, we don't want to interfere with that. And we would encourage you to connect with your own healthcare provider if you are needing specific advice about your situation, whether it's a medication, a test, or some symptoms. Please do reach out and connect with them. And we know many of our colleagues have set up systems where you'll be able to connect together by a phone or some other sort of video application. But I'm I'm pretty sure that healthcare providers are available to you. When you enter your questions into the Q&A box, we will do our best to get to them, but we want to give you the heads up that we will do our best to answer these questions in a general sense. Like, are these types of medications okay for people living with high blood pressure? As opposed to a very personal question, should I stop taking this pill? We will go back to the previous bullet. If you really want to know for your own situation, then we would encourage you to link back with your own physician, nurse, healthcare provider about those specific kinds of questions. And then finally, we're going to anticipate that you might have a whole bunch of questions. We'll do our very best to get them answered during this session. But if there's a whole bunch of questions, we may not be able to do so because of time. We will do our best to get them answered soon and return to the website cardiaccollege.ca, and we'll start to post up questions and answers that do seem to have a common theme. Okay, so I do see, thank you for somebody joining in on the Q&A right now. Let me just take this, a couple of them before we move on. And one of our colleagues on the line is talking about stress and mind-body connection. And for this individual, they feel that stress and body actually connect very closely together. They're feeling anxiety from this whole situation, and that may be putting stress on the cardiovascular system. And so how much risk are we being subjected to? What I'll say to this is that absolutely, we do recognize that there is this close connection between mind and body, and bringing some information into the dialogue is actually critically important. That's why we wanted to do this. So thank you very much for that point. Stay tuned about sources of information and the whole agenda that will be laid out for you. And this is going to be an ongoing dialogue. And then another question before we move on. This individual who's been perhaps a cardiac rehab participant is getting up and out every day for a walk. Is this okay? And of course, we do believe that getting physical activity in is absolutely important, respecting the physical distance kind of principle. So as long as you're feeling well, you've not been told that you have a diagnosis of COVID-19, or that you're in some sort of quarantine or isolation protocol, then absolutely it's okay and actually quite good for you to get out. Okay, so let me just put a pause on the questions for now. I appreciate that you've got them, and we want you to keep going with those. We'll come back to some of your questions as we move along. Through this as well, we're going to be offering up some polls because we want to get some feedback from everybody all together as a group. So here is an example of a poll that we would like to offer up that will tell us a little bit about who's in the audience right now. So you'll see this poll, I think, on your screen right now that is going to ask you two questions. The first one is just tell us about which country you're from. We don't want to find you in any way, but we just like to get some sense that we know some of our attendees are from our own programs here in Toronto. We have circulated the information about this webinar to others that are in partner programs around the country, as well as abroad. It seems from the number of responses that are coming in, I see them coming in real time, that of the 56 people online, thus far, 11 out of 56 are all from Canada, 12 out of 56. I'll carry this on for 10 more seconds, and that'll give us a bit of a feel for this. We have one from Latin America. Lovely. Okay, so I will just take the prerogative of ending this poll at this moment, and I will show you, and we've got two things here. One is, where are people from? So 93% of us are in Canada at the moment. One person is from Latin America, one is from Asia. Hello to everybody locally across Canada, and then for a couple of colleagues around the world. And We have a second kind of where are you from sort of question. Half of us are participants in the rehab program from our local program here at Toronto Rehab. A few are from our partner program at Toronto Western. Others are from other cardiac rehab programs. There are a few of us that are healthcare providers, so we appreciate our colleagues joining us for this information session. So this is great. Thank you very much for sharing those results with us. Okay, moving further on. So what are we trying to achieve in this series of education sessions? Today's is an introduction. It's an orientation for why we believe that this is important. And we do feel, we'll make this point, that staying connected and learning together is a critically important activity in this time. We want to provide an overview of the available resources that you can start using today. For those of you who might be in our local cardiac rehab programs, you probably know this material pretty well. For those of you who are from outside, I would say that this might be a nice introduction. And for all of us, these are freely available resources that we encourage you to have a look at and peruse and share very widely. We'll also present a bit of a calendar event, so what you can expect from us and from each other over the coming days. And we would also really enjoy getting feedback about your ideas for future topics. Already in the Q&A section of this platform, you're providing us with great ideas on where we need to focus going forward. And this is going to be an iterative build. Unfortunately, we may be together for several sessions over the coming days or weeks, and we look to bring relevant information to you over that time. Okay, let me jump into the heart of the issue for this session in particular. I'll do a run of about 15 minutes or so with some content, and then I'll pause for some questions at that point. Why are we interested in engaging with you today? Well, we know that education is a global standard in the cardiac rehab realm. If I extend this further, this applies equally all across our health domains, whether we work with heart disease or diabetes or mental health or other kinds of conditions, or whether we are a person with a lived experience. We all recognize that knowing more is critically important. In our finite area of cardiovascular rehabilitation, all of our major societies, and I've just called out here in an ABC format from the United States, from Britain, from Canada, that we all endorse as professionals and as a patient community, that patient education is indeed a global standard. It's something that we really need to provide. And frankly, it's something that we're actually acutely missing in our program because we haven't been able to see you face to face. And hence, that was the impetus for us to bring this to you online. There is the importance of patient education. Why do we think that this is important? Is that we recognize there is actually a very strong relationship between what we know and what happens downstream for people with lived experiences. If you know more, you'll probably do better. And if we can provide the right kind of education, we think that this actually does lead to improvements in knowledge that then lead to changes in behavior, like eating better and moving more and not smoking and taking medications. And then this translates into better health, that we have better control of our symptoms, that we can get out and do the things that we need to do. And a number of our studies collectively across all of our programs across Canada and around the world have demonstrated that we can achieve excellent outcomes for people living with heart conditions down the road. So we can avoid getting into hospital and staying well over the long term. And I know all of us are extremely committed to achieving these excellent outcomes for all of us right now. So I'm going to focus in a little bit on the resources that we have available for you, just in case you hadn't seen them already. For people who are in our program, you may have had some awareness of this. You may have also just received print resources in our program. But just to recognize that we have actually built a website for you. It goes under the banner called Health eUniversity. And when we built this some time ago, that we recognized there was actually this opportunity to share our resources quite widely. with our communities. And Health EU was a resource that was available for everybody to use from the get-go. Within the university, we actually had these colleges that we built. And for those of you who are in the academic realm, you recognize that universities are often built with these specialized streams underneath them called colleges. So we're referring today to the college in the upper right that's devoted to heart health called Cardiac College, but there are these other available resources in the cardiac and diabetes realm. This is for you, and we've never needed this more than now, so we're glad that it is a resource that is available. To give you a sense of the purpose and the design of how we put this together, there are many, many smart people in the program that work with many, many smart and committed patients together to build this outstanding resource. And the design of this was very purposeful, that we thought that there's actually 5 elements. It's not just education kind of blindly. It's not just posting up an article, which actually can be incredibly important, but we wanted the whole thing to make sense. Ultimately, we thought that if we can focus on these 5 areas, that would be a way to improve knowledge, to change behavior, to improve a health outcome. And if we start with the section that's at the upper left, if we can share information to help all of us understand and treat a condition like heart disease, that's a great start. And then if we can work on a couple of behaviors like getting active and eating healthy, that would be terrific. And if we can do that every day, that'll move us further down the cascade. If we can also think of the close connection between our physical health and our mental health, as one of our colleagues online has already pointed out to us, that's tremendously important. So it's important to feel well. And then if we could put all this together to build our control of our own health, then we are doing extremely well. 5 program pillars. So that purposeful design you'll find throughout the materials that we're sharing with you in the Healthy University, within the Cardiac College. Here is the information. And if you are a visual learner who likes to click through web pages, then all the material is laid out there. If you like the material kind of put together, collated into a manual, then you'll also find that on the landing page. And here in a red box, I've called out for you, if you want the guide, as people in our program may actually get a copy of a book manual if you enter our program, this is where it's at. If you want the electronic version that you can put onto your electronic reader or put it onto your laptop or simply access every now and again, then it's available for you as a download. The structure looks like this, that there are a series of 9 booklets, that take you through all of this information around those 5 pillars. So you'll see in blue, or in the light blue, how your heart works and common types of heart problems, through to common tests and treatments that you may have had an experience with just recently. Taking your heart medications as a critically important behavior, and these medications contribute to your health, to the top right of managing your symptoms. Although many of us may not be experiencing chest discomfort or shortness of breath right now, some of our colleagues are. And it's important to recognize those symptoms, call for help if necessary, or find a way of coping with it in the most positive way possible. Turning to the left lower panel, staying active. You'll see that color-coded in green. And these color themes are actually very consistent throughout the web source as well as through the booklets. Yellow shows eating well for a healthy heart. The purple sections talk about stress and relationships. And having great connections with people. And in the bottom right is setting goals for a healthy heart. So the entire guide is available to you and laid out in smart booklets, good simplified text and lovely graphics throughout all of that material. We recognize that many people around us, certainly living in Toronto, living across this country, and certainly internationally, may need some reference sources in different languages. And this was our start along this project line, And it seems like great. We've got these things to share right now. You'll find that these are also posted up on the website, that you have your English language resource as well as a French language resource. And we have developed other translations and adaptations in Spanish, Portuguese, Punjabi, Hindi. We will soon be posting up the simplified Chinese version, and we have others in the works. So please do revisit the website periodically. You'll find more of this information over time. And here is a nice example of our colleagues around the world. And it's almost like they're saying, we're in this together, we're learning together, we're being healthy together. They're not socially distancing or physically distancing. We'll show you because this was in a happier time. But this says where we are in this community sharing the information together. And these are examples of programs around the world that are engaged in our cardiac rehab, cardiac college community. Okay, I'm going to pause for a moment and just look at some of the Q&A issues that are coming up and see if I can look at something here. One comment is about mentally supporting or providing that physical and mental health connections. And trust me, we're going to come, when we come to the scheduling, you'll find that there's actually a whole day and a theme devoted to mental health. And I do appreciate that. Someone mentions that they might need some regular blood tests in order to adjust medications, and wondering what the access for that might be. I'm going to take that one offline, and we'll come back to you with a reasonable response to that as we look for resources that might be available for you. And someone points out, as we age, our immune systems might become more vulnerable, wondering if a heart event might actually alter our immune system further. And my quick answer to that is, I don't think our immunity per se is affected by heart, but I think what we've been hearing in the news is that there are some of us that might be living with a number of chronic conditions in whom, if we got an infection as the first step, and if that infection became more severe, that it might challenge our whole physiology even more. And that's why we all want to practice that physical distancing, wash our hands, don't touch our face, stay well, do all of those things to try to prevent us from getting sick in the first place. And then a final question is about the value of interval training to improve heart pumping function, such as ejection. And this gentleman is looking online at studies from Norway. Congratulations on looking at some of that medical literature. I believe you're talking about interval training or high intensity interval training. And trust us, if you stay tuned, we're going to devote our Thursdays to different kinds of exercise programming, and we will definitely get into that over time. Thank you all for sending in those questions. Keep them coming along. I see we're up to 65 people online. Outstanding. Okay, so if I walk through further resources that are available for you, the team has done such an outstanding job in developing and curating resources. I don't know about you, but our family at home is certainly spending a lot more time preparing meals and eating together, which has been such a tremendous, like a positive effect out of this madness that is going on. And we're looking to make some healthy food choices, maybe find a fun recipe to try out, or looking at how I can do something with a can of beans. And if I wanted to do that, I could go to this website, link on the Eat Healthy section of the web platform, and maybe even look at the Making Healthy Food Choices. And there you're going to find a whole series of very nicely produced videos on choosing healthy foods. And you'll see the range of topics. Here's a sampling from choosing a healthy bread to choosing a healthier cheese. So if you get to the meat section or the dairy section, how can we demystify high fat, low sodium, high sodium? What do all of those sorts of things mean? Why might it be important to choose some nuts and introduce them into your day? if you want a packaged drink or something new that you can try out, what might an attribute of a healthy drink might be. So there's lots of great food resources that are there. And you can choose to watch short videos, 2 to 3 minutes, that will take you through that. And you can even download a lovely tip card that you can take to the grocery store, or go online and say, I would like a bread with these sorts of attributes that might be high fiber, whole grain, low sodium, as examples. So while we're away thinking about food even a little bit more, we can think about what we need to do to make some healthy choices. So that's terrific. And if you want to do a fun little test as well, you might say, let me try to see how healthy our diets are right now. And here is a simple little test that you can try out called the Mediterranean Dietary Scale or Dietary Score. There is an online version right on the website that'll ask you about what kind of oil do you use? Are you eating enough fruits and vegetables? It'll ask you about the types of animal proteins that you might be using. Are you having sweets or muffins and things like this? And give you a little bit score, as well as some tips on how you might be able to eat more Mediterranean. We think that's important because that's a way that has been shown to correlate with some very good heart health. Another thing that you can do is think about your exercise. So someone's asked us about getting out for a regular walk, and we think that that's fabulous. And for those of you who are part of cardiac rehab programs, we know that this is a great way of staying healthy, doing your prescriptions, and checking in with your cardiac rehab professional if they're available from time to time. If you want a little bit more information about something like resistance training, then if we go to the website, you'll find here on the left-hand panel a resistance training video gallery. If you're missing seeing your cardiac rehab professional and wanted to get a refresh on how you might work with some light weights or with some rubber bands and doing some exercises, then these are all exercises that have been sanctioned in our program as safe and effective. You might want to check in with your cardiac rehab professional about which exercises might be the best for you if you're able to link in with them. But if you needed a refresher or want to create a playlist of certain kinds of exercises, then these are available to you. And if you click on one of these videos, this is what it might look like. And this is Danielle Lawrence, one of our exercise professional team members, who will show you how to do a bicep curl with a band as an example. And if you wanted a slightly different way of looking at all of this information, if you're looking for a challenge, then we would encourage you to go to this section of the website that is called Thrive. And we can package the materials that are here slightly differently. And here the team has created for you a 12-week challenge. Now, we're hopeful that we won't be under this type of isolation for the next 12 weeks. But if we are, or if you just want to do something for fun, Thrive for 12 weeks will bring up this tile cascade, and you'll see that there are 12 tiles here. And it starts with creating a plan for change and ends with choosing health every day. In the middle, you can choose your own journey each week. You'll be asked to look at the session, learn, plan, do, and reflect on an activity for the week, watch a short educational video, create a personal action plan, write it down, make a commitment to yourself, and move through it. And this is another fun way that you can actually have some health and make strides forward while you are at home. You can look at this as, wow, this is quite a gift that I actually can work on my health. And what we'll commit to you as a team, I know the kinds of individuals that I work with on a daily basis. They are incredibly committed to your health. They're incredibly committed to their own personal health as well. So we can share our stories along the way. And I will strive personally to do the exercise prescriptions with you through these course of 12 weeks. I will commit to you to trying out a different kind of fruit or a new vegetable each week as well to make this fun. So that brings us then to what we will be doing together online. Even if you don't join us, even if you're going to duck out and say, I've got enough for me now. There's this whole rich web platform that maybe you knew about already. Maybe some of you didn't know about it. It's all there for you. We will also commit to engaging with you on a regular basis. And here's what we've come up with so far. The team came up with this platform very, very quickly, got the web links posted up, and you'll find that there'll be at least a week of activities that will be posted up with these simple Zoom links. And I hope you did find it easy. And what we'll find going forward, today's session was an orientation, but starting next Monday, we'll be focusing on mental health topics, like how to cope with stress, how to sleep better, thinking about depression and anxiety, and other topics that you will declare will be important. On Tuesdays, we're gonna hit some of the special topics, the things that are in the news. So for instance, I've already had a conversation with a few people online and on phone about certain kinds of blood pressure medications and whether they're okay for your heart or not. Or you may have heard that aspirin, some people are saying, may not be the best thing for your heart. So we're going to dive into topics like that on Tuesdays, and I'll be working with my medical colleagues both here in Toronto as well as wonderful colleagues in other programs to join us for these special, we call them hot topics. So if you've got an idea of a question that you would like answered in that venue, then please do submit them through the Q&A, and we'll line them up over the coming days and weeks. Wednesdays will be devoted to eating well. And we thought we would start this with a topic about foods that may boost your immunity. The punchline here might be, there may not be any specific superfood that we may be eating well for our immune systems. It's consistent with eating well for our hearts, as well as eating well for our minds, as well as eating well if we're living with diabetes. There's a lot of commonality for that, but certainly there's been a lot of focus on things that we can do for our immune systems. And we've got a wonderful team of dietitians in our program who will be bringing this to you on Wednesdays. And if you've got some specific topics you'd like covered off, please do submit that through the Q&A. Thursdays, as we said, will be devoted to topics around physical activity and other related topics around your heart. And we can look at those questions around interval training, aerobic activities, resistance activities, activities you can do in your own home. And if we get sufficient interest around these, maybe we can even create some bonus sessions with live demonstrations, or at least video demonstrations of exercise. There's lots of things that we can do with this platform now that we've created it. And I'm just checking online, 68 of us are online doing these sorts of things as well. And we're so glad that you are joining us. Now, we actually have a great library of topics as well that we can draw from. So we'll see over the course of the next month on where to interject some of these topics. And as we said, that these align pretty well with what's in our books and our website already. So topics around taking care of your heart, how your heart works, common questions related to tests and therapies, and taking your medications, and knowing your risk factors. Let's not forget about taking care of our heart while we're also trying to avoid coronavirus and other sorts of things. Topics around staying active, such as the exercise safety and resistance training. And boy, do you believe it? Spring is coming and summer may be around the corner. And if we're going to start to get out in hot weather, then we should be thinking about that. And maybe you've been doing the same thing for a few weeks already, and you'd like some information on how to step things up a little bit in a safe and effective way. And we'll talk about that. And if you ever had any doubts about why exercise is a good thing, we can revisit some of those topics. Eating well, we'll cover off how to choose some healthy foods and healthy ways of eating, and maybe even something like how to read a food label. If you've got the can of beans at home, let's take a good look at that. And as we said, important topics around feeling well. Ultimately, we hope that everybody will be able to take control of your own health. At this time, we think that there are many things that are beyond our control, that the world seems to just be going through really difficult times. The news just seems to compound and present us with really challenging headlines. There are some things that we can commit to. There are some things that are in our control, and we can set some small goals, have a vision to be healthy, develop an action plan that's within our own environment, within our own steps, within the food products that we have available. And if we can think about the barriers that might get in our way, how do we come over that? I'll give you some insights into our daily lives in clinical care. This is what we are doing every single day, and every day feels like a whole week as we react to the issues in our environment. But we get through it by following these steps exactly. What are we trying to achieve together? Where do we want to get to by the end of the day? What are the actions that we need to take? What are the barriers that we'll want to overcome to get there? So each day can actually be a very satisfying day as we ourselves take some control over this. And as we present each section, we'll refer you back to the website and to the guide wherever relevant, so that you can do some of your own homework and reading around these topics. Okay, so I've talked a fair bit right now. I'm going to return to the Q&A for just to see what else is there. And let me see one specific question from a person about recommendation for resistance band brands and where to get them. In our program, we tend to use the brand called TheraBand. I'm not recommending that as the only one, because there probably are a number, but that just happens to be the one that we use in our program. If you happen to be able to get to a fitness supply shop online and they have any kind of rubber tube band or elastic band, all of that will be great, and all of them can work extremely well for you. We'll take some time and source out what might be conveniently available to you and endeavor to share that during our next exercise session. Okay, so let me see if I can do this and flip a video for you about how we can stay safe and stay well at home.
Hey everyone, I'm Alan.
And I'm Joel.
And we are Toronto Emergency Doctors. We want to give you some information on COVID-19 and what you can do to protect yourself and others during these stressful times. In Canada, we are seeing more and more patients diagnosed with COVID-19.
We are at an important moment in time. What we do now can make a big difference to slow down the spread of this virus and protect vulnerable members of our community. Here are some things you can do to help. Wash your hands well. Use social distancing. This means avoid larger groups and stay 2 meters apart from other people when possible. Stay at home as much as possible and avoid travel. If symptoms start, stay at home and self-isolate.
All these things will help to reduce the number of cases that happen all at once. This will help our healthcare system to manage and provide the care that each patient deserves. It is true that many people who get the disease will only have a mild illness. However, certain groups of people have higher rates of illness and death. This includes people over 65, people with heart and lung conditions, and people with weak immune systems who are more at risk.
Here is some information about the strategies and recommendations used at COVID-19 assessment centers. There are lots of public health reasons to follow this advice, but when it comes down to it, this is about keeping your elderly family members and loved ones safe. Many of you have family members, like your mother, father, grandparents, that are over the age of 60. Think about that person the next time you're wondering about social distancing and hand washing.
If you do not have symptoms, testing is not helpful. Even if you've been exposed, the testing will only become accurate once you develop symptoms. If you have traveled or been exposed to a person with COVID-19, you should quarantine yourself at home for 14 days.
If you have symptoms, you may consider going to an assessment center. Public health organizations have resources, including online assessment and tools to help you decide if this is necessary. If your illness is very mild, it is better to stay at home, as visiting an assessment center will not guarantee that you are tested for COVID.
When you come to an assessment site, you will clean your hands and wear a mask. We will take your vital signs. We will ask you about your travel, contact with others, and your past medical history. After these steps, a decision will be made whether to test you for COVID-19 or not.
Even if your symptoms are mild and we decide not to test you, you may still have COVID-19. At that point, you'll be asked to go home and self-isolate. We know everybody just wants to know whether they have COVID-19. However, we need to use our resources to test people who are at highest risk.
So where to next? Once the assessment is done, if you have any symptoms, you may be asked to self-isolate for 14 days after travel and until all your symptoms have been gone for at least 24 hours. These recommendations are constantly changing. Right now, this all means stay at home, limit the number of visitors you have, avoid contact, and keep a safe distance from others. Also, remember to wash your hands and cover your mouth when you cough and sneeze.
If your symptoms get worse, get reassessed by a medical professional. Most of all, it is important to stay safe, calm, and informed. Until next time.
So that was an example of a video that was produced by colleagues at St. Michael's Hospital. Hopefully you found that useful. It's important to find these kinds of credible sources of information to keep yourself informed going forward. Okay, so we're near the end of the formal parts of this, and to summarize that we do believe that health information and health literacy are very important, and we would like to be able to share education with you going forward. So check in each day, 1 o'clock, Monday through Thursdays at this website, and we will endeavor to bring you some good, credible information. While you're at home looking for other kinds of things, other sources, then please be aware, and I think you are at this point, that we have a lot of resources already available for you at the Cardiac College website in multiple forms, in multiple media, and in several languages as well. We encourage all of us to stay connected, to share information with each other, and through this, we will endeavor to be. Let me turn back to the Q&As as well as other items in the menu to see if there's other things that we can look at. Someone is asking about COVID-19 per se, wondering if runny nose per se is a symptom of COVID-19. Is this true or not? Well, I guess what I would say to this is that there is a range of symptoms that have been associated with COVID-19. Some have characterized it that it might resemble something like a cold. Others have suggested it might represent something like a flu, and there's the things in between. Maybe the question is, if it's just a runny nose and otherwise you are well, you don't have a cough, you don't have fever, you don't have shortness of breath, then this may not be COVID-19 and may not be something that we need to run out to an assessment center or to medical professionals for. But I think you're raising a great point that we do need to just be vigilant about what's going on with ourselves. As a healthcare team, we've been advised by our infection control specialists that our best defense overall as healthcare practitioners also is that we need to be self-monitoring and just do a check-in with yourself every now and again about how you are feeling and wonder if that runny nose is getting into anything worse. So thank you very much for that question. And anything else that we want to look at? Okay, great. Well, here's a couple more Q&As coming in. Trying to keep up here. So someone is asking a specific question about cholesterol medications. Maybe the way I'll take this is that, so if we are on some kinds of cholesterol medications or any of our heart medications, I think the bottom line around advice is that we do our best to stay on the medications that we have been prescribed previously. If you want to have a conversation about what other medications might be suitable in your situation, then once again, I would say check in with your healthcare practitioners. Typically in our programs here, when we do Q&As around medications, then people do ask, what are the alternates to certain cholesterol medicines like statin drugs? And there are other ones that are both prescriptions like ezetimibe or injectable medications like evolocumab that could be available. You'll need to chat with your doc about those prescription medicines. Others may turn to really focusing in on more plant-based diets and exercising more, which also contribute. They're not a substitute for the medications, but certainly go hand in hand with that. So if you're wondering what to do at this point in time, then do check in with your healthcare practitioner. Okay, I think I've used up about 50 minutes of our time. Someone is wondering about an important question about, could you be contagious if you don't have symptoms? And I know this has been an important question back and forth in the media. And I think most people that are infection control practitioners would suggest that the time of highest risk of transmitting virus is when you have symptoms, and hence that's when people will focus on getting tested and going into isolation. You may have heard stories from elsewhere that it is possible, I say possible, that some people may not be showing a lot of symptoms, but still potentially be able to transmit virus. And this is why the notion of physical distancing is really critically important. That one of the reasons why we might want to keep apart is that we're never really sure, certainly out in the community, of where others have been. So if we can stay apart, not breathe in each other's faces, not spread droplets to each other, and keep our hands clean and washed whenever possible, then this is the way that we will reduce transmission and contagion. Wash your hands, don't touch your face, don't get close to another person, don't breathe on them. And I think those are some of the good public health measures that we have heard. Okay. So I've not seen anything else come in online. I'm going to take the prerogative as host to call a close to this session. We appreciate you joining us on phase 1 of this journey. And we anticipate that over time, we'll have some more colleagues join us locally, across this country, and perhaps around the world. So this is a great start to building our community. We appreciate that you've taken the time out of your day to join us. We've enjoyed having this interface with you, and look forward to our next engagement. So come on back online, 1 o'clock tomorrow. We'll start with some hot topics around medications, your heart, and COVID-19. Take care, everyone, and have a healthy day.